INEBRIA organization is the international network for brief interventions for alcohol and drugs. Healthcare professionals could give brief advice to people who are drinking at risky or harmful levels, and many people would reduce that harmful or hazardous drinking significant amounts. So it's a very inexpensive way to address a huge public health problem.
And certainly screening and brief intervention is one of the, brief counseling interventions is one of the ones where there's been a lot of research and it has been found to be very effective. It's so effective that every incoming college student should be screened for and counseled about alcohol use.
Sometimes we assume because you're from a certain ethnic background, country, or religion, alcohol is not an issue, or certain drugs aren't an issue, and I think we really need to not assume that.
Expert is developing comfort level with motivational interviewing skills, because the more you use motivational interviewing, the more likely you are to have a non-threatening, non-judgmental conversation with the student about their risk. We'll ask a student who says, "Oh well, I smoke marijuana just occasionally." "Well, thanks for telling me that. Tell me, what do you like about smoking marijuana?"
Even though I know there's debate in the motivational interviewing field about the value of asking people what they like, you need to find out what are your reasons.
Is it the pain? Is it the frustration? Is it the loss of identity? Is it the people staring? What is it that's driving you to want to kind of get away?
One, we never want to ask a student to make a change without knowing the benefit of the behavior. And secondly, it's the student who lists the reasons that the use is a problem. Well, if my mother found out, I'd get in trouble, my grades have gone down.
Conversations with trusted adults, and I would say health professionals, using evidence-based approaches, which would be validated screening questions, shown to work in diverse populations and not just making it up as you go along.
Have you ever carried a weapon? Are you afraid?
And the goal was to identify a brief screening test that would be practical for use by pediatricians.
Do you use drugs or alcohol?
And so we came up with a 6-question brief screen that's known by its mnemonic acronym, the CRAFT.
And now it's electronic, and we can, on an iPad, we can get all kinds of questions answered.
And so when they answer those questions, they flag red if they're a negative or a positive.
Flag on it, flag on the plate. It suggests that there's a risk factor here and that you have to address.
As the provider, I'm looking at these questions, and for me it's easy. I pick out all the red ones and I focus on those red ones.
And the way I like to use it is to say to my teenage patient, I got this card at a recent meeting that I went to, and scientists had determined it was a pretty accurate test. So do you mind if I ask you the questions? I've never had a teenage patient say, "Yes, I mind." It's like they're intrigued. They want to take the quiz.
So we conducted a study among adolescents aged 12 to 18. It was about alcohol prevention text messages. So what we did basically was we sent them prevention messages for alcohol and drug use. Messages like small reminders, don't drink and drive, and if you're at a party, try to get home safe, things like small reminders. Our intention was to make them think about the consequences.
You have to address the adolescent pressing and presenting concern, that you need providers that are adolescent friendly, that you need a friendly environment.
It's interesting to me that even those who know adolescents have a lot of preconceptions or beliefs that aren't always necessarily accurate, such as when I tell them they do care about their brain, they do care about their future, even if they can't articulate a clear vision of their future, or they come from a disadvantaged circumstances where they don't have a lot of hope for themselves. They do care, and we owe it to them to tell them, and then to find out what do they think about the information.